Right along. Your other press conference this morning was about children's health insurance, addressing the copious amounts of uninsured kids here in the state.
Yeah. Well, you know, this is a fight I've been leading. I'm glad to have gotten $650 million into the supplemental appropriations bill for SCHIP, the State Child Health Insurance Program, which we call the New Jersey Family Care. Of that $650 million, which is to address the shortfall that existed for SCHIP, where the states were finding themselves short of the monies necessary to finish the fiscal year to cover kids and some immediate family members. $100 million is going to come to New Jersey, and we succeeded at that. But now the question is the reauthorization of the law. This law that authorized this program is going to expire at the end of this September 30th. We need a full-term reauthorization of the law. And in that reauthorization, my fight that I have been engaged in is against a White House that wanted to do two things that would have been hugely detrimental to New Jersey. Number one, eliminate all parent coverage. One of the things New Jersey was able to achieve with waivers from the Bush administration was to be able to take working parents, but who are low income and don't qualify for Medicaid because they work more than that poverty level, and at the same time don't get health insurance at work, to be covered if their child was being covered at the same time. And through that system, we ended up getting to more kids than through systems in which we didn't cover parents. And we succeeded at that, and the administration not only gave us waivers, but they actually complemented our success. Now the administration wanted to knock all parents off in the reauthorization. That would have meant 80,000 parents in New Jersey who are presently enrolled under SCHIP would have been knocked off. And it wanted to reduce the level at which we can fund children at 200% of federal poverty level. We in New Jersey are more progressive. We fund children at 350% of federal poverty level. That would have meant that 30,000 children would have been knocked off of health care who already have it. In addition, that it would have limited our ability to go after more children in our state who have no health care coverage and some of their parents. I'm proud to have led a bipartisan effort in the Senate, believe it or not. We actually got some moderate Republicans to join us, where tomorrow the Senate Finance Committee will mark up a full 5-year reauthorization that does two things critical to New Jersey in addition to reauthorizing the program as a whole. It will continue to allow states to, like New Jersey, to continue at the 350% of federal poverty level, and it will continue to allow us to cover parents, and it will allow us to do it at the higher match rate. Otherwise, we would have lost $110 million. 110,000 New Jerseyans would have been kicked off of their insurance, and we would have lost $44 million in health care insurance. And going forward, we wouldn't have had the wherewithal to insure more children. That's what's coming out tomorrow. Unfortunately, the president has issued a veto threat, and I say to the president, bring it on. Where are your values? It's time to stop picking on children and start time to insure them. It's time for you to meet your 1994 campaign promise that said that you would insure every child in this nation under SCHIP. You're not doing that under your proposals. And finally, I don't understand how we can spend $100 billion to give people making over $200,000 a tax cut in 1 year, but we can't give $10 billion over 5 years to insure children in this country. And so that's what our fight was going to be about if the president insists on his veto threat.
Well, why do you think the administration is so hostile about this issue? I mean, these bills get paid eventually. I mean, it's not as if not insuring these kids makes their health care costs go away.
Well, you're absolutely right. First of all, we totally pay. We Democrats believe in fiscal responsibility, which means not only do we propose programs, we pay for them, unlike the administration that puts debt on the next generation of Americans. We pay this by a 61-cent increase in the tobacco tax. And so the $10 billion extra that we want to put in is fully paid for over the course of 5 years. Secondly, you're absolutely right, John. When in fact, a child has no health care coverage and doesn't qualify for Medicaid because they're not at that poverty level, and their parents have no health insurance and can't afford it, when they get ill, what do? They go to the emergency room. And when they go to the emergency room, they are more ill, and that is more costly. And we all pay through charity care. And so, bottom line, it's penny wise and pound foolish. And the reality is that it is immoral. It's immoral in my mind to say that we can give $100 billion to people making over $200,000 a year, but we can't give $10 billion over 5 years 5 years to ensure